I'm excited to have Lorelei Brown talking. I'm sorry? No? Lorelei Brown, I'm sorry. Talking about all the hurting she's done in her family and some of the challenges she's had to deal with and how ass-kicking really is the best medicine.
So, wait, I have a lot to say. Shh. Okay, so this came out of a lot of frustration in dealing with the medical system, getting nowhere, and realizing that we were really in a shitty space. I recently was at a party and got drunk with a doctor who says, it fucking sucks being a doctor. I can't actually treat my patients. I have to just go and run tests that an insurance company will like or Medicare will like, and I can't actually practice empathy. And when you get empathy, you get a sociopathic doctor like this who doesn't actually listen to you, which means they can only go through your test scores and look at your stuff. But, damn, this is like, okay. They don't get into the basis of the complications of diagnosis. These are two diagnostic tools. One of them is from WebMD. It starts out with a symptom of leg aches, and then it gets to all this stuff that could possibly happen if you had a leg ache. It's complicated. It doesn't really get into this aspect of patient-physician communication. They know that you need to be satisfied here. They also know that you may be unsatisfied and become angry and sue them. So my point in this is monitor yourself, get your data, and have a conversation with your doctor as a peer. You're the person who knows the most about you. Go back and look at this diagram, but basically it says monitor your health, your exercise, your medicines, and the events. Sit down with this doctor, have this conversation, collaborate, and realize that you are the subject matter expert about your health. This is just like this crazy Doppler effect thing going on, like one of this really long. So when you do this, come to them and have some credible research done on your own. A lot of things that doctors rely on are stuff that they learned 20 years ago. Time has marched on. If you can come to them and say, I read about birth defects at the March of Dimes, they can probably come up with you and help diagnose. Probably everybody has heard about, if you hear hoofbeats, do you have a zebra or horse? It's up to you to kind of fill in the blanks when they tell you something that you think is complete and utter bullshit, to give them the background, to talk to them in this peer-centered environment. Your doctor is not necessarily an authority figure, and you don't have to do what they say. This is a very fine print of something called Against Medical Advice. If you are in a hospital, if you are in your doctor's office, you never have to do what they say. I know all of you have not stopped smoking or lost 20 pounds or exercised 30 days a week, and you don't have to do any of that kind of stuff. Instead, talk to other people who are going through some of the things that you are. And this is not to say to go to all the forums and read all the scary stuff and how salt is going to make your head explode, but do start keeping in mind that there's other things. Also consider holistic medicine. Things that are kind of weird and wacky are commonplace in every other country. Yoga calms us down. It's now prescribed, but it was crazy 20 years ago. Acupuncture in China is very popular. At some point, though, you need to know when to stop if someone is a complete whack job. I did have someone tell me the way to cure my aching back was that we should eat lentils because the moon was round and we would feel a fullness in our body, and I left. The bottom line is that if it doesn't hurt and it makes you feel better, do it. So have some green tea, hang upside down, pray, think happy thoughts, journal, whatever. The way you think you feel has a lot to do with the way that you feel. Ultimately, at some point in time, you're going to have to help other people make decisions. And this also really, really sucks. You're in a position of having to be the recorder and advocate while still being in a flexible position. The best advice I can give you for this is to keep your sense of humor. This is a cartoon called Cancer Vixen, which talks the journey of a woman who had breast cancer. You need to be in a position where you can take all this stuff in, process it, provide some levity, and don't be the one who makes the final decider, but definitely do be the persuader, especially if you have people who can't speak well for themselves, such as kids. This is my baby. She can't tell the doctor what's wrong with her, and she's kind of a freak of nature because she's a baby. But I need to go to a pediatrician who says, Mom always knows best, because who is the subject matter of my baby? I grew her. It's mine. Finally, always make sure you have directions for what happens when you go out of the doctor's office. These are two These are two discharge instructions. One of them tells what kind of test you have to have. Another one gives big photos and tells you when to worry and when it's okay and when it's fine. And finally, the best ass-kicking method of all is to take time to take care of yourself. Eat well, exercise, go to the movies, have sex, get a good night's sleep, have a glass of wine occasionally, and you'll kick ass.